Good afternoon. Welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center and United Medical ACO. I'm here with Dr. Isaias Irgau, our program director and the president of CHRIAS. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's as usual, it's one of my favorite times of the week, Bariatric Friday. I'm happy to be here.
All right, thank you so much. And this channel is the voice of those individuals who are struggling with morbid obesity. As the morbid obesity is one of those illnesses that was actually defined as an illness very late. This was back in 2010. There are a lot of catch-up we have to do. This catch-up includes dealing with social stigma. This also includes the traditional education that's being given on morbid obesity and how morbid obesity is affecting our lives. And is it an illness or is it lifestyle choices? And even sometimes, me personally, I make the statement by not thinking that, I'm actually saying that, but just because of the habit, we have that. So then I realized that this is a great way for us to be able to address and share the information that public should have on morbid obesity. Earlier, we addressed the issues with diabetes. So interesting enough, diabetes is never by itself. So it always have these friends of other illnesses, which we call comorbidities. So, and morbid obesity is one of the most common comorbidity for other chronic illnesses, which is a risk factor for all of those illnesses. So that's why we are here today, and our format is to kind of take it in small pieces and then discuss this issue with the expert. So it's not like some marketing people who are talking about this. It is the surgeon who is perhaps one of the best in the world, because we are one of the earliest adopters of bariatric surgery, and we have done so many of those. I, as the program, one of the program administrators, I've been in this program for more than 10, 11 years now actively. And understanding morbid obesity is important, and helping our patients is our main focus. Having said that, today we are going to discuss the life expectancy and how it's actually bariatric surgery is associated with the longer life expectancy, and how we can actually add more healthier lives for those others, those who are dealing with morbid obesity. So Dr. Irgau, you are on.
Absolutely, absolutely. Kemal, it's interesting actually, because the session you had previously was dealing with diabetes, the one you had with the United Medical team. And one of the comments that was made, I believe it was you, was that the prevalence of type 2 diabetes among people age 65 and over is over 35% right now. And that's a staggering number, right? Type 2 diabetes is overwhelmingly associated with overweight and obesity and morbid obesity. And if you think about it, if we are getting this disease as we age, the chances of us not being able to survive to the full extent of our life are going to get slimmer, right? So we have diabetes to that extent in our society right now because obesity has become so prevalent. And obesity is not going to eat into our health and our quality of life, but also in our ability to stay alive longer, right? It is essentially a very modern disease. It's associated with the rise of obesity. And if you look at the life expectancy improvement over the last 100 years, Kemal, you would see, decade after decade, an increase in life expectancy, right? We used to talk about people in their 60s being very old, right? 40, 50 years ago. right now, people are living much, much longer. Life expectancy has increased. And that has to do, of course, with improvement, of healthcare, with access to healthcare, a lot of improvement in our society in many ways. And yet, that progress is being threatened right now, right? In the past, each past generation was living, less than the future generation. In other words, the children outlived the parents in terms of how long they lived, right? Because there was progress in life expectancy. Now, for the first time, maybe the parents have lived longer than their children, because their children now, with the prevalence of obesity, life expectancy may start to go down, right? And this is really the topic of our conversation. Why is life expectancy improved after bariatric surgery? Well, it's not because bariatric surgery by itself has a magic formula. It's because bariatric surgery is attacking the very threat to our life expectancy, which is morbid obesity. So we are not saying, hey, if you want to live longer, come and have bariatric surgery to everyone. That's not what we're saying. We're saying if you're suffering from morbid obesity, the chances are that you will not live very long, right? Because morbid obesity by itself is associated with very, very important health problems that are life-threatening. And at the moment, the only effective treatment we have, durable, effective treatment we have for morbid obesity is bariatric surgery. Therefore, bariatric surgery is associated with a prolonged life expectancy.
So I'll tell you something interesting happened yesterday. One of the meetings for our new surgery center, as many people may know, you do need a certificate of need. And because our focus is bariatric, we have to make a point why we need more OR. So, and I find myself educating the team of my, so our legal team was there. So, because we have several lawyers, so I don't have to say which one, right? So, even their understanding of morbid obesity was so little, where I had to explain, okay, look, this is not someone who can actually lose this by doing, diet, exercise. So we are not talking about someone who's maybe 20 pounds heavier than their ideal weight. We are talking about people with 100 pounds minimum, which is just sort of put it in perspective, I'm 220 pounds, so 22 maybe. So that would make me in order to qualify for this one, I need to be over 300 pounds.
Yeah.
So, and that's a huge undertake to go from there to the ideal weight. And then even my sense from our legal team was, so why can't they lose weight with changes, modification with the lifestyle and choices that they make? I'm like, so this is where we start. So this is why also it's important for us to have these events, just so that people can keep hearing the same thing maybe. And we probably have to say the same thing again and again and again, because many people, even people who may be more educated, their understanding of this issue is same, not getting it, not knowing. Then that's not their fault. But on this one, we are looking at it from a very different perspective of it, not just resolving the issue, but being able to live with your loved ones for another 5, 6, 7 years.
Absolutely.
Quality life, right? So that's, how much, would be, because, okay, so let's try this in a different way. So someone who's dealing with morbid obesity, let's say BMI 52, is not going to live until age 80, 85. Chances are that's not going to happen, right?
Yeah.
Imagine your mom, your dad, your siblings, your partner who is dealing with this, and then you lose them 10 years before, at age 57 or age 65. So then another 5 to 10 years is huge, right?
Oh, absolutely.
And it's a good quality extension. It's not like they're going to be in a coma for that time, right? So this is why it's really important for people to understand. So it's the most efficient, most effective way of dealing with morbid obesity, period, right? So alternatives, yes, there are miracles. Well, miracles don't even work for us. I mean, it's like you do really good for 1 week, but then if you have too many meetings next week, you don't do physical activities, or your friends are buying you milkshake, then you are in trouble, right? So this is a very big challenge for all of us, but being able to extend the life expectancy is huge.
Yes,
so
absolutely.
We can put some light on that.
So let's connect the dots, right? If you look at the most common causes of mortality in our society right now, right? You have cardiovascular diseases, which include heart disease, like heart attacks, right? It includes high blood pressure, strokes, right? And then you have metabolic conditions like diabetes and the consequences of diabetes. And then you have cancers. And guess what? All these three major categories are heavily correlated with obesity. So if these are the most common causes of mortality in our society, it just makes a lot of sense that, you know, a lot of the people who die early because of this are actually morbidly obese or obese people as well, right? Because obesity is what is driving the prevalence of these conditions, right? So if you are able to cut obesity, if you are able to stop a person from gaining weight, if you are able to get a person from, if you're able to get them to lose significant amount of weight, you're also freeing them from the ravages of these diseases. Therefore, they are likely to live a lot longer. And as you said, there is no more important gift than you can give to a human being than time. Time, right, is the most probably precious commodity humanity has, right? You want to live longer, you want to enjoy life, you want to be conscious, you want to be with your family, right? One of the most common reasons patients come to me that is they've come to a realization they need this surgery, although they were afraid about it for a long time, because now they want to see their grandchildren graduate from high school. They want to see their grandchildren graduate from college, right? They want that time, right? And they understand that obesity may be a great obstacle for them. And what we are saying is that, look, you can try many other methods, but when the weight is about 100 pounds or more over your ideal body weight, the chances of a person succeeding in losing weight just by doing diets are not there, right? It's going to be a vicious cycle of losing some weight for a while, and then that will stop, and then the weight will come back with a vengeance. Not only that person will have a very hard time losing the weight, Kemal, but the chance of them continuing to gain weight as they age are very high. Therefore, it's almost like a vicious cycle. You have obesity, which is going to shorten your life, but that obesity will invite even more obesity, which will shorten your life even more, right? And that cycle can be cut with bariatric surgery right now. But then let me go back, right? This connects the dots, right? But let me go back to what you were saying earlier on, that you were having a hard time really relaying this point to people who are not in the medical field, right? Very well-educated people, right, that you were discussing with, right? And that is really at the crux of the problem that we're having, in that if you look at the numbers, only about 1% of people who are eligible for bariatric surgery are actually seeking out bariatric surgery, right? Which means that society still has this huge bias against people who are struggling with morbid obesity, and it's preventing them from seeking the right treatment. Granted, there are fears, there are concerns because it is surgery, but also surgery has come such a long way now, right? In terms of its refinement, its safety. I mean, you've seen it in our bariatric program over the last 3 years, how many serious complications have you noted, Kemal? Very, very little, if any, given the magnitude of the surgery, right? Because the preparation is very rigorous and the surgery has been refined to a great extent. Granted, there are still risks, right? There is no option without risk. But what we are saying as healthcare givers, Kemal, is that we have to be able to guide patients to understand the risks and benefits of the options they have. And we are saying that if you have morbid obesity, the chance of you dying early, the chance of having health problems are much, much, much higher than having bariatric surgery to take care of that, because bariatric surgery safety has been improved to that extent right now. And therefore, we're not saying there are no risks. Of course, there is nothing, no treatment with zero risks, of course, but we're saying the risks of staying obese are so much higher that the option of bariatric surgery should be almost, readily present. But education is needed, obviously, for us to get these measures through, and the programs that you are undertaking, Kemal, with Bariatric Friday is part of that education process, of course.
Yeah, I mean, I think again and again, the issue is when we, when we repeat our knowledge about morbid obesity, sometimes do they really not get it, or are we okay? Like, we don't need to repeat it, and then every time the answer is we underestimate how bad the other side is in terms of the understanding. So you don't have this problem. You don't have this burden on diabetes. You don't have this problem with chronic kidney problems. You don't have this problem with the cardiovascular issues. So there is this, if morbid obesity was a person, it's just trying to be accepted by the others, saying that, look, I'm also an illness, and a chronic illness, can you please, accept me in this group? And while it's happening, I think a lot of people are not benefiting from having the surgery. Now, as you know, we deal with different, when we have problems, I have this simple, diagram, like current situation and ideal state. Yeah. So when you look at this from one side of the equation is the current situation. So if the person has morbid obesity, and the ideal state is, healthier, better life, and we can add the longer life into that. So then we look at it, okay, from those two, what are the barriers in? So, thanks to Obamacare, I guess, so no one is without an insurance, and we take Medicaid in our surgery center and in our practice at CHRIAS. So, everyone has insurance, and the barrier of financials is gone, right? So even if someone doesn't have a job, if they're on Medicaid, it is covered benefit. So we can say that there's a barrier, so I couldn't do it. Well, there's not enough expertise in the area. Well, that's not a barrier, because there's CHRIAS and American Surgery Center, and we've been doing this for almost 23 years now. So, and the barrier is for us to, maybe for our understanding and for our commitment. So, and then for that, we have the team of care coordinators. We have the team of the social workers, psychologists, bariatrician, nutritionist, the surgeon, and all of our care coordinators. So all that is there. So then we actually remove all the barriers. So then one cannot have any excuse anymore. So usually, let's say if I want to buy a private jet, because my current situation is I don't want to be tortured by the really bad what do you call them? The airline employees, they torture us, right? So the current situation is that, but the ideal state, remember, we couldn't come back from one of the conferences that we had, and then they didn't care, right? Yeah. So the ideal state is if we had a private jet, then we would be able to fly back whenever we want. Doesn't matter. But the barrier is financials.
Yeah.
So we don't have the money to buy. Even sometimes people who have the money, they cannot justify if it's going to lose, right? So I'm just using an analogy just for people to kind of understand this. So if the barrier is something that I cannot remove, getting to the ideal state is going to be so much more difficult.
Absolutely.
But in this one, we build a program, and so that issue is gone. Like even just having these events in the last 2.5 years, it's another barrier that's actually what's available to the public regarding the surgery, regarding the process. Our support group is part of the removing those barriers. So that's when we do that. So when we make this decision, then ideal state is you're going to be with your family, with your loved ones, longer, healthier. So that's kind of like, can I actually, exchange that with anything else? I can't, right?
Absolutely.
So no,
Absolutely.
I mean, if I was able to get 3 more years for Buddy,
Yes.
I would.
Yeah.
Right?
Yeah.
I would have. So, and now this is a person, this is your family. Now we want this a bit more. So that's why we need to make this understanding very clear and encourage our friends, families, and educate them. So that's the only way that I think we are going to be able to get to a better level. And I think we'll get our credits later on. I think that the recognition is going to probably be a little bit longer, but people will understand 5-6 years from now what we have done all these years. That's going to be really important for people to know. And I feel that this from that.
Absolutely, Kemal. So, it is very interesting here that when you hear people having reservations about bariatric surgery, particularly the ones who are not struggling with obesity themselves, their assumption is that, people are struggling because they're not making an effort, right? Clearly, we're not saying here, come and have bariatric surgery and then don't worry or don't feel healthy. Far from it. What we're saying is, look, you are trying, right? You've been stuck in this weight, and every time you try and you finish, you come out with one weight, you've been frustrated, right? What we're saying is continue those efforts, but we will give you a tool that will make it meaningful, where now, for the first time, you will actually see results, right? And those results are likely to be permanent for you if you continue with that renewed energy, right? So people give up not because they don't want to try, but because they're disappointed time and time again with the fact that they cannot actually get beyond a certain weight. They lose 10, 15 pounds, and then it stops there when they actually need to lose 60, 70, 80 pounds for them to have a meaningful change in the quality of their life, right? I saw a patient in office hours yesterday, 63-year-old gentleman, body mass index of 53, right? That person has diabetes. They're taking medication for type 2 diabetes. That person has high blood pressure. They're taking medication for high blood pressure. They have severe joint pain for which they take medications and they get injections. They walk with a cane, right? They are depressed, right? And so they take medication for depression. They have severe anxiety. They take medication for anxiety. And on top of that, they smoke. And the reason because they smoke, Kemal, is because that's the only thing they think will prevent them from gaining even more weight, but also it helps them deal with a very, very difficult mental state they are in because of all these problems that they have a hard time defeating. Now, if you really home into it, Kemal, the main issue that person is struggling with is the weight, right? Having a body mass index of 53 is carrying all those burdens alongside with them, right? And that is eating into the quality of life of that person, right? But also, what are the chances for that person's quality? I mean, life expectancy to be a normal one, right? It's very low. That person is likely to die before their time because of the illnesses that they are undergoing. And that person knows it. They are dying very slowly under the burden of obesity, right? So when I put it to them at that time that we can provide, bariatric surgery in the form of sleeve gastrectomy, which is likely to liberate them from a substantial amount of weight and therefore improve diabetes, improve high blood pressure, right? And then I said, the most important thing I need you to do for us right now, sir, is to stop smoking. He looked at me and he said, I'm going to gain weight again. I said, look, we can deal with that, but you need to stop smoking to start making changes. And then the option, once you lose weight, is for you to have a completely changed trajectory. You may not need to use the cane. You may not need to be on those medications. You may not be as depressed as you are right now because of everything, around you seems so gloomy. And that person smiled, Kemal, and they wanted bariatric surgery immediately. When I told them that because of their insurance now, they have to go through a process of preparation that's going to take 6 months, they really wanted it done immediately once they understood, how important this is for them. Of course, part of the discussion we had was the fact that that person needs to change how they live as well. Right now, they have hope, they need to adjust their eating habits. They need to have a rigorous form of exercise within the limitations they have, but there is hope now, hope for a new life, hope for a prolonged life. And that is what bariatric surgery can provide for, to a person who is suffering from morbid obesity.
Absolutely. I think one thing that I want to emphasize, so surgery, bariatric surgery, yes, it is the most effective, most efficient, but it's not a magic, right? So it's a tool, you said it's a vehicle, which means going back to this current situation, ideal state. So you need tools and vehicles to remove barriers. For example, if I'm down in Bear, and then if I'm going to go to Wilmington, what is the best tool, the best vehicle to do that? I need speed, I need power, I need time, the timing of it, availability of it. So now, right now, a personal car is the best way to go there. Now, you can also go there with a bicycle. It's going to take a lot longer, and it's going to take a lot more effort. But this is a very powerful tool. So that's something that should be kind of clear. So I don't want to confuse anyone from that point. The other thing is that, and I'm sure we have this, what I'm about to show you guys. That's our goal for our primary care practices as well. But our surveys, patient satisfaction, about 194 surveys that we have done in the last 12 months, 98.5% of the patients, and some of those, if I open them, you can actually see them on our website because we are posting them. It's overwhelming. It's amazing. And I'm extremely proud of our nursing staff because we always talk about our surgeons and our care coordinators, but our nursing staff at American Surgery Center is doing an amazing job.
Yes.
And the result is 98.5%. This is not common in facilities like ours.
Yes.
So, and that means patients are also happy. That means they are happier with their experience and the results in many cases. So, anything you would like to add, Dr. Irgau?
No, I mean, you've summarized it, Kemal. You say this is a vehicle, this is really a tool, and that's the way it should be understood as well. Obviously, a person who is not going to make an effort to change their lifestyle, having bariatric surgery may not be the best option for them because, success may not be as easily reachable. But what we're saying is the vast majority of people are making an effort. They want to get rid of the weight, and it makes so much more sense for them to utilize this tool to achieve those goals.
And we'll be here again next week, discuss another topic of bariatric surgery process and dealing with morbid obesity. Today we discuss the life expectancy and bariatric surgeries association with that. And please follow us and look at our other videos if they're all indexed very well. So whichever area you may need the most help, that would be, we made it very easy for you to find them in our playlist. Hopefully we can be part of your journey, and then we can be part of your success. And you can live longer with your loved ones. And then we'll see you next week. Thank you. Bye-bye.
Thank you. Have a great weekend, everybody. Thank you.